wonderful speakers, what do you call that? And Chairman Dr. CAA Harvinder Rao, Chancellor of course, and Dr. Srinivas Rao, and dignitaries in the dais, senior and young faculties of the Senior Institute of Medical College, and more importantly, parents of all students of a very batch of 2019 who have just finished their internship, and of course, same batch, my dear students. Yes, journey continues. Uncle, about that, good word. Journey, how is that begun is very, very important, I think. First and most important, priority, like Sir because has told, parents, they are the backbones of all of you. So they need to be careful. Just to give stand up and be approach to them, they are the backbones of all of you. Because they support affection and incredible encouragement, you won't be able to reach this side and finish what is a milestone is a graduation. Thank you. So next is so how we started this journey. I know NEET exam, PhD, go there, don't want to do everything. Then eventually get into medical education, very difficult. So we got elected, get into that. And when you get into that, so there are two things that are important. What you will have, what you have, when you join the MBBS is innocence and curiosity. That's how after we join and we have innocence and curiosity. That is very, very important. Then eventually mold into a proper graduation. But this curiosity should persist because medical profession is endless. Learning is there to end to learn this profession. It is a continuous phenomenon. It is not a one-day match. It is not a T20 match. It's a test match. It's a series probably because you have to do MBBS, post-graduation. Then after that you get recognize yourself you are. By then almost you are pretty old. So it's a long journey. So you have to make up your mind for this. So there are two things that are important. Positive thinking. That's the one, and determination and dedication. Because we are already in this discussion, patience is most important. Perfection is the target. Perseverance is the inevitable requirement. Perfection, patience, perseverance. So the most important thing is that in this medical education to come up. Additionally, my advice is don't give up. Because so much challenging it is, so much distressing it is many times when you seek it and round the clock work on that, you won't get the proper result of the patient, you are tired, exhausted, many times half stop, no stop. Still don't give up this profession. Continue to work on, have a challenge, face the challenge. You will reach what you are goal with your success. Second thing is don't go up. Go up means differently, I must say. You should reach your success. But don't have an ego. Ego is the most dangerous thing, especially in the medical profession. I will add on to that, especially truly in surgical profession, because ego kills you, especially in surgical side. So we should have a confidence, but never make a mistake. There are two things which I have faced until now many times. We'll have a team and disaster. Many can try, twice, so many times, then we lose the patient. Major surgeries, emergency surgeries, so many times. We never intend to lose any patients in our professional career. But happenings are inevitable, we have to learn the truth. So this is a disaster, and many times we save the patient, they become all right, they are very happy, they are especially that's why it is really working for us. That is what dream and disaster. That is hero and villain, Amitabh Bachchan and Amarish Puri. You should balance your mind both good and bad in the two parts of your life. Life is a game, and medical life is a challenging game. It is not easy target. So you need to have a focused work, determined work. That is what is required when you go ahead with what is called as medical life. Many times factor was your own life, personal life, and so on. And the third thing is do not differentiate at the medical profession, be basically rich or poor. Your treatment strategy, your principle of management of patient should be same, equal, and dedicated. Maybe they have infrastructure, they will have a big room, all those things, may not have just a different thing. But I am working in Wenlock. I am also taking private practice, but we will never intend to differentiate that the patient is poor in Wenlock, whether the patient is rich in a private practice. Our target is treat them effectively, efficiently, and send them home with a smile. So that attitude should be there with all of you. This is the thing. Do what you love. That's so important. Your focus, your target, what you want to do. Maybe strategic, maybe medicine, which should be that most of you might have already decided what you want to do. Of course, with the eventual need exam result, you may have to come to join join structure which you are not probably keen to join. But eventually you need to get into the subject. Slowly you learn the art of managing those patients, and that art makes you to love that subject, and you need to listen to that, what is called as involvement. Without involvement in this profession, you will not be successful at that point. Very, very important. It is not an involvement for a few hours, it is not involvement for a few days, it is a continuous phenomena. Hours, the days, the weeks, months, and years. It is a continuous phenomena. There is a break, there is no break for that until you finish until the end of your practice. So involvement is important. So do have a love your profession, do have a love your subject which you have taken or acquired or whatever it is, and have a faith on yourself. Have a truthful for yourself, to your patient, to the society, and to the hospital you are working, and to the system aspect. The truth and faithfulness is very, very essential. Because in every luxury is needed, it should be essential, but it is more and more focused in medical profession, which is a requirement because you are going to deal with the patients who are ill, patients who are not well. And your behavior is very, very important in this profession. I'm not telling other professions who do not have a good behavior or not, because they are not observed in the public. We are in the public domain. Wherever poor patients, they are public for the society. You are in the society. You are observing, every inch and every movement are observed by society. And you get into the hospital, people will watch you, patients will watch you, parents will, their parents or adults will watch you, public will watch you. So you should behave dignifiedly. You should behave what others expect. Otherwise, another thing, you should articulate your words with your seniors, with your colleagues, with your faculties, with your top members, or with the public as such. In a careful way, your articulated word. You are not here to have a loose talks anywhere. This is the profession. This is a very serious business. It is not a casual work at all, unless you quit the profession. So this is what's important. Your articulating words in this profession, wherever you are, is very, very important. Keep an eye on that. And I have seen few of my colleagues, they are arrogant, I should not tell that, sometimes cynical, sometimes brittle, sometimes tough. There is no need to do that. Be humiliated, be simple, because there is no need to require to criticize everything. You need to be very certain solution for everything. There are certain ways to handle these things rather than criticize everything is not an orderly fashion, especially for this profession. Number. And another thing is don't forget your detail. Don't forget your faculty and Samnamata, colleague efforts, and don't forget your carers, because they are everything for you to make you better. And more importantly, speak with the law. This is important. And have an eye of compassion. Speak with the law. Have an eye of compassion. Have a ear to listen with the patient or illness. Take some time to listen them. Keep your ears open. This is most important. Many times I say, I'm a person. I became very because I have seen all levels. I worked in a place where there was no ultrasound, only X-rays were there. Make level B has come, laparoscopy has come, robotic has come, CT scan come, MRI has come. I have seen the older person, newer person also. But my approach is always for the older person, of course, with the acquired newer technology. So keep to the patient, listen to the patient. This is very, very important. Many times correctly it is say, there is no presenting, they will take one time, speak to me, it doesn't tell anything. Take 5 to 10 minutes, you can have a clear idea about what you want to tell, what patient want to tell, what you want to track. So that's very, very important. Sit and speak to the patient. It's lacking nowadays because everybody is busy. So, but that doesn't serve the purpose what you are going to discuss. Next thing is have a breath without ego. Moment you go, you will tell yourself. There are two things, confidence and ego. Confidence is important. Desire is important. You should have desire. Yes, I'm going to become certain, also go on. I have my MS, I have my FRCS, I have done books. I'm happy with that. So I have my desire. Ego is different. Ego is, I'm only doing everything. I'm only doing good surgery. I'm only good surgery. Others are not going good surgery. That is a very fast image what you are having in your brain. Everybody can do what you are doing. That is system to remember. None of them are having ego, especially the people system. And most importantly, don't dissuade hands of the receiver patient. Patient has come to you because they have been, they are ignorant, they are innocent. It's our business to talk to them. It's our business to think about them. It is our business to make them all right. Within the period of what is available, within the period of the what is the pathology or disease matters. So this is very important. Finally, of course, you are young graduate, a long way to go. You should have dream. Dream to go to success one. How to do that? Direction is important. Second thing is confidence is important. Third thing is imagination. Dream is the direction, confidence, and imagination. You will definitely be very, very, very successful. Look at that. Successful should come on its own. It's a long way. Don't tell the success zone based on the richness. Money is not a parameter to say that he is successful. It is a professionalism, dedication, work ethics, how exactly he lives his profession. That should be the diameter to assess his profession. So I have a best profession like overall my teachers or faculty, and have a best dream and fulfill your parents' dream, whatever it is, and of course, you are the future of this. I'm 72 years old. I have finished my 75th year of life. Maybe if I serve my 80 years, maybe if it's so. So whatever that I am successful until now, I maintain my successfulness. Maybe for another 10 years. I don't require to go ahead at whatever I achieve. So just maintain that it's sufficient. But for you are still young, you have a long, long, long way to go. So have a better thing. Be very good future for this society, for this country, and for the people, for the patient as such. So students, thank you very much for inviting me for this farewell, Sankalp, have best Sankalp, do well, my best wishes. Thank you so much.